begin by saying that I'm speaking for the children who don't have a voice, those who are living with trauma. Last week we heard the senior coroner's report after a child here in Calderdale took her life in January. The court heard how she's fallen through the net during the battle for mental health support. We heard how both the GP and the school had both left it to each other to refer her for a mental health assessment. This little girl was struggling, and her mother, who's very frustrated by the situation, had seen her behaviour change. She took her to relate to the relationship therapists, and they found no red flags. However, when detectives went into her room to try and unpick what had happened in this tragic event, they found that drawings indicating suicidal thoughts were on her desk. Children do not always have the words to speak how they feel. Sometimes they have to express themselves in other ways. This is where evidence-based creative arts therapies can step in. Creative arts therapists are trained to identify these warning signals and work with the child and the family through their difficulties. This child was an intelligent and sensitive child. She'd not presented as a child in crisis. We do know that she's not the only one. According to the NSPCC, suicide is one of the 3 most common causes of death amongst our young people, and it's on the rise, as we've heard tonight. Trauma is stored in the body, and it cannot be worked with, unfortunately, online. Key data on adolescents published by Public Health England states that half of mental health illness starts by the age of 14. This confirms the need for early intervention in terms of delivering therapeutic support in primary as well as secondary schools. Public Health England has identified strong links between well-being and learning and school improvement. So if we put these services into our schools, schools will improve. I'm aware that there's a real appetite for change in this council. Calderdale does care. There's a real will to deliver better services. I'm sure that you'll agree that we're here to drive improvement of services. We know funding is diminishing. However, we also know that despite the shortage of funding, there's still a strong commitment, as we've heard this evening, to want to make it better for our children and young people. The situation between the GP and the school confirms the need for a joined-up approach. We need to pull the agencies together, as been talked about this evening, in the public sector, private sector and voluntary sector. We need to work together on this on a cross-party approach. We must take the leadership as a council to support this process in our schools and within our communities. I would like to harness your enthusiasm to want to help our young people who are struggling. I would like us to support schools to deliver evidence-based therapeutic intervention that works. Other local authorities and education establishments up and down the country are already seeing the benefits of these services in place in schools in Bradford, Leeds, Oldham, Newcastle. In Manchester, One Education has been commissioned to deliver creative arts therapeutic intervention to over 40 schools. They work with the full continuum from early intervention through to complex cases of abuse and with children that are not being engaged with in CAMS. The head of Youth Justice team in Manchester has been thrilled to see the results and are commissioning these services to support children who are also at risk of offending. I want us as a council to reduce the pressure that GPs and teachers are facing, to deliver mental health assessments. I want us as a council to recognise the valuable work they do. Teachers do an amazing job at educating our children. It's unfair to expect them to deliver mental health services or assessments when they're neither trained or qualified to do so. To train as a psychotherapist is a 2 years master's degree. It's hundreds of hours of personal therapy and then several years of clinical experience with supervision. We have to be clear at what level we're expecting them to deliver or refer pupils. Tier 1 is currently not being dealt with. I understand that Tier 2 has been looked at and it's out, it's been commissioned, but the Tier 1 is not being looked at. The world that we live in now is far removed from the world that many of us have grown up in. The pressures of social media may mean that children with low self-esteem are constantly measuring themselves with one another online. the cyberbullying that many parents may not be aware of, and the access to internet sites that promote self-harming. May I finish? I've only got a few lines.
No, I think you can. I think this is really important. I think this is probably the most important thing we've had this evening.
Thank you.
Megan, I'm happy. No, I'm happy to let this finish.
Thank you. The access to internet sites that promote self-harming, eating disorders and suicide. According to NSPCC research, these factors coupled with isolation can cause a devastating effect on our young people who are already vulnerable. Each and every one of us here tonight needs to make a personal commitment, as we already have done, the conversations we've heard tonight, to support the mental health needs of our children and young people, and each and every one of us needs to put a stop to this suffering. I urge you members to vote for this motion tonight.
Thank you. The reason I allow it to carry on, it's a very emotional and a very moving motion. It's a member's first motion, and to choose something so moving and so important, it must be admired and supported. There's a point of information I have on this.
Thank you,